Do you want to throw this whole law out, or is that a distraction from the main issue, the economy?
Well, I think it's extremely intertwined with the economy, and I think it's an example of where Washington doesn't get it. One of the reasons we don't have significant job creation is the federal government itself. We haven't created the confidence, we haven't created the certainty for those who could invest and create jobs, and what we've done is put up roadblocks to that. Look, we're approaching the healthcare problem the wrong way. As a practicing physician for over 25 years, the one thing you want to do is fix the real disease, not the symptoms. And the Affordable Care Act fixed a lot of symptoms, but not the disease. And the disease is this healthcare costs too much. And with the Affordable Care Act, it's going to cost a whole lot more. Now, the estimates with the Supreme Court ruling is about $1.9 trillion. We don't have that money. $1.9 trillion more over the first 10 years it's fully in place.
No, Senator Coburn, but doesn't the CBO has scored this as not just deficit neutral, but actually saving taxpayers $100 billion,
No,
correct?
Well, that's true, but that is not true. If you go look at their latest scoring, they score it as a cost. They also score it as a costing tremendous a number of jobs. And the other thing, they have not scored since the Supreme Court ruling, which is going to markedly increase the cost of the exchanges. So that's not accurate. This bill costs $1.6 trillion minimum. It's going to cost more than that with the changes that the Supreme Court made in terms of the optionality of Medicaid for the states.
I know.
So the point is that we ought to fix the problem, not the symptoms, and you're hearing all this politics about it. What we should have is real access and real care for people without an insurance company or the government between the patient and the physician. And we've not done that with this bill. And a lot of the programs that are out there today don't do it. And we need to change health care in America. But what we've done is making the problem worse, not better.